This video will explain how to establish a person's cardiovascular health status so that you have an understanding of the problems they're having with their heart and circulation. By establishing a person's cardiovascular health status, you will be better able to support them to select health goals that are relevant to them and will have the greatest impact. Cardiovascular health goals will be different for each patient and will depend on their preferences, but it is also important that goals are relevant to their cardiovascular health. The Cardiovascular Health Goals flowchart on page 6 of your manual shows a variety of cardiovascular goals and actions that can be worked on with the patient. Outcomes towards the left-hand side of the flowchart will have a faster and greater impact on patients' cardiovascular health, so it's important to encourage prioritization of outcomes towards the left, moving towards the right if these outcomes are not relevant to the patient and their health. Much of the information you need to establish a person's cardiovascular health status can generally be found on electronic patient record systems such as System 1 and EMIS. A number of health conditions affect a person's cardiovascular health. These include cardiovascular conditions themselves, such as coronary or ischemic heart disease, angina, acute coronary syndrome, heart attack or myocardial infarction, stroke or transient ischemic attack, and peripheral vascular disease. A number of non-cardiovascular conditions also increase the risk of cardiovascular disease, including raised cholesterol, chronic kidney disease, diabetes, and hypertension or raised blood pressure. Information on a person's health conditions can be found in the medical history section of their electronic patient record. The Cardiovascular Health Goals flowchart on page 6 of your manual highlights the importance of two key types of medication. The first is antihypertensives. These are medications that help lower blood pressure. For those who are aiming to lower their blood pressure and have already been prescribed this medication, it's important to check they are taking it as they've been instructed. The second medication is statins. Statins help to lower cholesterol and so are important for those who are aiming to achieve this. If a person has a cardiovascular disease, check that they are already taking a high-dose statin. Those who don't have cardiovascular disease but have a Qrisk score of more than 10% should also be taking a statin. If they're not, ask them if you can refer them to the GP to discuss this option. A Qrisk score is based on a range of factors such as blood pressure, smoking status, and family history. It tells you whether a person is at low or high risk of developing cardiovascular disease in the next 10 years. A person's Qrisk score can usually be found in their electronic patient record. A Qrisk calculator can also be found at qrisk.org. You can find out whether a person is on medications to lower their blood pressure or cholesterol by looking in the medications section of their electronic patient record. Usually, though not always, statin medications have statin at the end of their name, for example, atorvastatin. Medications for high blood pressure have a variety of names. If you're not sure if the patient is on medication for high blood pressure or high cholesterol, discuss it with one of your clinician colleagues. Cardiovascular health is also influenced by a person's lifestyle. Lifestyle factors that can improve cardiovascular health include stopping smoking, reducing alcohol, increasing exercise, and a healthy diet. A person's smoking status may be recorded on their electronic patient record. You can get information on other lifestyle factors by speaking with the person directly. In this example, I am reviewing the cardiovascular health status of a test patient using System 1. The first thing I do is retrieve the patient's record and look in the medical history section of the record. From this, I can see here that this patient has 2 conditions that will affect their cardiovascular health. Acute coronary syndrome, which is a cardiovascular disease, and type 2 diabetes, which increases their risk of cardiovascular problems. Next, I look at the patient's medications. They don't appear to be taking any medications. However, their diagnosis of acute coronary syndrome means they have cardiovascular disease. They should therefore be taking a high-dose statin. I will now need to speak to the patient about this and ask a prescribing clinician to review the patient. Finally, I meet with the patient and establish directly with them that they are a non-smoker and non-drinker. They explain that they are eating more healthily nowadays, but they aren't getting much exercise overall. To summarise, the important factors influencing this patient's cardiovascular health status are: they have acute coronary syndrome and type 2 diabetes, they haven't been prescribed a high-dose statin as they should, and they may need to increase their level of exercise. I can now use this information to support the patient to select health goals that are relevant to them and will have the greatest impact on their health.